Hi everybody! Welcome back to another episode of Simply Healed by Simply Nature. And today it's so exciting. Our topic is for Valentine's Day! So hello again to Dr. Johnson.
Hi everyone.
So today I'm the one without the mask. Dr. Johnson is the one with the mask. We gotta still keep our social distancing.
Yeah.
So we're very excited. Our topic today is how to get your skin ready for Valentine's Day. And to all the girls and guys out there, I'm sure this is on the top of your mind. There's that special someone, especially in the pandemic year, all that someone is even more important, right? Yeah. So Doc, we have a special guest today.
Yeah, a very special guest. Someone very close to my heart.
Oh, maybe Valentine, huh?
Yeah, Valentine.
Okay, Doc, why don't you introduce our special guest for tonight?
So our special guest for tonight is someone very close to my heart. She's actually my girlfriend, Dr. Grace Lim. She is also a lifestyle medicine specialist, just like I am. But she is more on. She takes her practice focus is more on for skincare. Okay, so I know a lot of you are preparing for Valentine's Day, and I'm sure a majority of you or all of you want to look good on the other side of that camera. Okay, so we still have to stay the social distancing, right, and avoid the social gatherings. But if you're going on a date,
Yeah,
very important.
all the more you gotta look good,
Yeah.
right?
And with all that mask, that's getting you maskne, acne behind that mask.
Yeah.
This video is for you.
All right. So without further ado, let's say hello to our special guest, Dr. Grace. Hi, Doc.
Hi everyone. Hi. Thank you, Sean, and thank you, Jansen, for that wonderful introduction. And good evening, everyone.
Wow, you are certainly qualified to share about skin with us because you have very good-looking skin.
Blooming, right? Blooming.
Blooming. Wow. Wonderful, wonderful. Dr. Grace is also very kind. She's going to give, like Dr. Johnson, a special Valentine's Day gift.
Yeah.
All right, so we'll be giving out three free consults regarding your skin issues, be it eczema or psoriasis. Dr. Grace is going to give a free consult after this because Dr. Johnson specializes in cancer. All right, so let's jump in. The first topic is that we want to stay focused on eczema and psoriasis patients, and also those patients with an acne explosion, right? Because it's Valentine's Day coming and you want to solve that quickly. But Doc, can I confirm with you, first let's talk about eczema and psoriasis. Eczema and psoriasis is really an immune system problem, right? It's not just a skin issue, is it?
Yes, aside from being two of the most common skin diseases known, or commonly, it's very common here in the Philippines, not only in the Philippines but worldwide. It's also a disease in the immune system, yes.
So we have our SimplyNaturePPARs for the immune system part. But tonight, we are so lucky to have Dr. Grace with us. So I wanted to ask Doc about skin. About skin. How does the eczema and psoriasis, right? How does the skin become like so red? What's actually happening on the skin?
For eczema, or most commonly, it's atopic dermatitis is also an eczema. It's a form of eczema. So usually it becomes very inflamed or very red, and I'll just run through about the features of atopic dermatitis. It's usually itchy or very pruritic, and it has eczema. It's very eczematous, or rather, it can be acute, subacute, or chronic. It depends with the duration, but most commonly, if we have eczema, it's very recurring. After being treated, it would always come back.
Wow, always come back.
Yes. For psoriasis, it's different.
Okay.
Psoriasis is more of it. It is immunologically mediated. It's an inflammatory disease, as characterized with skin inflammation. It would also It also has epidermal hyperplasia, but this is medical. It's more of medically characterization. Increased risk of a painful and destructive arthritis. So aside from being a skin
Oh,
problem, it's also a systematic problem, or it affects the whole body, as well as cardiovascular, and of course having psoriasis
wow.
is very difficult. Yes.
So you it's not only a skin that you see your cardiovascular system gets affected,
Yes,
and
it can.
and joints. So
Yes.
rheumatoid arthritis is actually like
It's
part of psoriasis, no?
no.
Okay.
Psoriasis is a form of an autoimmune disease.
Okay.
So your immune system attacks your own body. It's just that for psoriasis, it's the skin.
Okay.
That's why they have these
But
flares.
they also end up with a lot of joint pains.
Yeah, which is
In severe cases, you
mhm.
have psoriatic arthritis.
Oh, psoriatic arthritis, that's right.
Yeah.
Psoriatic arthritis. Wow.
Yes.
Doc, I have a question for you. I'm sure now Valentine's Day is coming, so all the patients out there with eczema and psoriasis will be preparing all their protocols, especially if they have a nice date in person during pandemic,
Yeah.
right? So what are the common protocols or steroid creams? What is the usual thing that a psoriasis and eczema patient will do to help them control an outbreak?
Yes, both eczema and psoriasis usually are treated with, the first line treatment would be topical steroids. But the downside of having to treat always with topical steroids is that it is not for maintenance. It's not for long term use. So usually we just apply them for 2 weeks. But as we know, as I've mentioned a while ago, both psoriasis and eczema are very recurring, or they are relapsing, meaning after they've been treated, then they will come again, and then they will come again. Sometimes it entails more than 2 weeks of treatment. So that would be difficult for the patient.
Uh, you said that topical steroids can only be applied for 14 days, right? The usual treatment. What happens if you use topical steroids for a very long period of time continuously?
It could cause irritation or inflammation. It could sometimes thin the skin itself because it's very potent. So we can't really see that like sometimes visually, but the skin integrity is already affected, and sometimes there is big
Pigmentation change, right?
discoloration of the skin
Coloration, yeah.
because of prolonged topical steroid use.
So, during that period when patients are off these steroid creams,
What do they do?
What do they do?
What
in
did they do? If you
between?
can't
Yeah.
use steroids all the time, what if you have another outbreak immediately after your
Yeah.
2 weeks?
Yeah, it's very hard. Sometimes the doctor will just put the patient on rest, so you don't use the topical steroids first, and then opt for another cream or another emollient, because for eczema they tend to have very dry skin. Actually also psoriasis, so we focus more on the preventive side. So for example, for eczema, it is closely related to allergy, so IgE, or it has an allergic aspect to it. So we advise the patients to stay away from perfumes, so that would cause flares, or
Wow.
that would cause, yes.
But
and
that's
and
all the
then
important ingredient in Valentine's Day, right? To smell good.
Smell good,
To
yeah.
smell good. You have to use perfume. You have to doll up yourself. Wow. So actually, it seems like if you are a psoriatic and eczema patient, Valentine's Day is not a good day, huh?
yes, it's very hard, and especially for psoriasis patients, because all their lives they usually deal with it. And
Wow.
if they're stressed, the flares would come back because its immune system is very dependent on the immune system. So if they're stressed, or if the immune system is very low, they have the flares again. So it has a psychosocial impact on patients.
Yeah.
Yes, for
I go through
psoriasis
back.
patients.
That's why we had a webinar 2 weeks ago when we talked about introduction for Itch No More on psoriasis and eczema. We can break the cycle, right, Dr. Johnson? We can break the cycle of this repeat cycle by addressing the immune system.
Yes.
And we can do that with the PPARs series. But today we are very excited also for our Valentine's Day. If you're eczema psoriasis patient, you've just used your steroid cream, and for the next 2 weeks, Valentine's Day is coming and you can't use that anymore, we have good news for you. But before we talk about ADPro, right, perhaps I would like to invite Dr. Grace to share with us what's this skin microbiome thing. What's your skin microbiome? Why is it important for psoriasis and eczema patients? What happens to their skin when they have outbreaks?
Yes, skin microbiome is very important not only for patients with psoriasis and for eczema. It's very important to everyone. So, because patients with eczema and psoriasis tend to have disrupted, or their skin integrity is not that good as opposed to those who are healthy.
So your skin breaks out easily, it gets hurt easily for eczema?
Yes, it's not as strong as those who have healthy skin. So it's very important to keep your skin microbiome healthy. So how can we do that? Before, we always use until now we use the steroids, but we could opt for, or we could add something to that by using probiotics. So few years ago, there has been studies supporting the use of probiotic serum, probiotic topical application, or topical preparation. So I've read, according to Dr. Whitney Bowie, probiotics benefit the skin in 3 key ways. First, they act as a protective shield by preventing bad microorganisms from provoking an immune reaction.
Wow.
So by that, this creates a more calming environment for the skin. Yes. And then secondly, they produce natural antibiotics called antimicrobial peptides that combat bad bacteria. And lastly, they boost the skin's functionality in dealing with external damaging factors such as free radicals, sun, pollution. So all of these benefits help reduce inflammation, which is very prominent in patients with eczema and psoriasis.
Wow, so it's even a sunblock.
Yeah.
So the skin microbiome actually protects you from even UV rays. Basically, it helps your skin heal. Wow, that's very exciting. So, we are very happy to announce that SimplyNature is launching ADPro. ADPro is Asia and probably the world's first probiotic. As Dr. Grace has shared, many years ago, skin doctors and skin specialists have already tried to use probiotic creams and serums. Yeah. But most of these products are no longer on the market because the efficacy is not at that medical level. But you can find probiotics in a lot of skincare nowadays.
Nowadays.
A lot of skincare.
Another reason is because these the treatments that we are so used to has a lot of side effects. For one, just like what Dr. Grace has shared with us, steroids, it can thin your skin. The thing that you are using to fight inflammation actually thins your skin, which brings in more inflammation.
Wow, vicious cycle.
The vicious cycle, right? Another thing is for the antimicrobials that we are using, especially for acne. Okay, so what the current the conventional treatment that we have right now is we use benzoyl peroxide. So that stuff actually irritates your skin to promote what do you call that exfoliation, or to hasten for your skin to shed.
Oh, like the peeling that they do. All right.
So that is the purpose. But if your skin gets irritated, it becomes so red, it's painful. Then when you go out in the sun, we are here in the Philippines. We're a tropical country. You go out there in the sun, cannot be avoided. You get the UV on the sunlight on your skin, then you flare up like a tomato. So
Wow.
That's going to be very irritating. So with this new product, ADPro, I'm also really very excited to prescribe this to my patients because this actually is a paradigm shift. You know?
Yeah, it is a paradigm shift. It is
Previously, we were using antibiotics to destroy the bacteria that is causing the inflammation. Now, what we're doing is to introduce another bacteria, which is a probiotic, which is a very beneficial bacteria in your skin microbiome, not to suppress, not to kill the microbiome, but
to strengthen.
Actually to suppress the
bad ones,
bad bacteria,
right?
not to kill them. Okay.
So it's more like Yakult for your skin.
Yeah.
Right? It's easy to understand when we say it's Yakult for your skin. Yeah, you know, thank you, Dr. Johnson, because it's so true. This is a new paradigm shift, you know. In fact, the last 3 years, just last year, late last year in 2020, one of the huge pharmaceutical companies just bought over a smaller one that specializes in microbiomes, using live enzymes, probiotics for treatment, not just skin, all over, all sorts of illness. So that's like the new cutting edge of biotech. There's a new approach, you know, like cancer, we used to do chemotherapy, now we are doing immunotherapy. And now for skin treatment, instead of using steroids, we are the many pharmaceutical companies are researching on how to use probiotics to restore the microbiome.
Yeah.
The good news is it's already done. We are here. Right? If you take a look at our Itch No More program, you know, Professor Candy here from Taiwan has made a breakthrough. Right now, she's like super hot in the academia. She's now invited to speak at all the lectures in Taiwan because her breakthrough in probiotics for the skin is a revolutionary approach. And at Simply Nature, we're so fortunate we are the chosen channel for her, and we are the first in the world to be able to push this out. So the first batch just arrived in Philippines in time for Valentine's Day. In time for Valentine's Day. Yeah. So, you know, without further ado, let's just take a look at some of the pictures that you see in front of the screen over here. Right? It's amazing. As you can see, these are the before and after pictures. These are patients who have suffered from atopic dermatitis for years. And you can see here, you know, you can breathe a sigh of relief. The time it took to see all these great improvements is literally days, right? And the last picture, this one of the baby's skin was like bark, right? And then it became smooth 20 days. Well, it's less than 20 days to Valentine's Day, but I'm sure for you, if it's just a breakout, this is going to help you.
Yeah. And you know, with our conventional therapies for these conditions, it takes weeks.
Takes weeks.
Takes weeks for you to notice some improvements. But with ADPro, I was also surprised. Took days. And you know, another thing that is good with ADPro is kids can use it.
Yeah. Kids can use it. Dr. Grace, just wanted to check. The dermatologist I spoke to said that for steroid creams, we try not to use it on the face.
Yeah, usually, we don't use it on the face because it's very potent and
toxic, right?
Yeah, because it can cause irritation.
Is it because the face is the skin is the thinner?
More sensitive. Yeah.
It's more sensitive.
Also, the skin on our face is more sensitive.
Right.
If so put it near our eyes.
Oh yes, right. When we sweat, the steroids will go into the eyes, and that's not going to be good. Right. Valentine's Day, your face is the most important. So today's topic is how to get ready for Valentine's. I mean, if you want a more serious, in-depth, take a look at our Itch No More webinar. Right. You can find it on YouTube. Right. But today, we want to thank Dr. Grace here to share with us how to look beautiful for Valentine's Day. So we want to stay on topic on that. So it really means that here it is something that you can use on your face for your eczema breakout. Return your microbiome to natural. Your skin starts to heal. It'll look good again. You saw the pictures. It's 3 days, 7 days. So you're in time for Valentine's Day. Any more questions you have for Dr. Grace?
I think
Acne. Maybe you can ask her about acne.
Oh, yeah, about acne. Okay. Okay, so for acne we have 4 key elements to its
Wow, this is new to me. I'm learning something
occurrence.
tonight.
Okay, so number 1 is epidermal hyperproliferation. That means the surface of your skin, the dead skin cells, is thick, or they are hyperproliferating. So the layer is thick. Actually. Okay. So with a thick dead skin cell, that is going to
no glow in your face.
Yeah, no glow, and that's going to block the pores.
Oh.
Okay, so that's going to block the pores. So if it blocks the pores,
Yeah.
then you'll have a problem with your sebum,
Which is the oil, right?
which is the oil. So it cannot break out of the pore.
So you end up with the build-up of sebum inside.
Yeah.
Sebum is good actually, but
Yeah, the problem is it's
stuck inside.
Stuck inside.
Okay.
So that's why you have this form of
a bump.
a bump, right?
Okay,
So
okay.
the next thing is, well, of course, the causative agent of acne is the Propionibacterium acnes, no? So that is what we kill with our antibiotic topical antibiotics, and then with all of that coming in, the bacteria and the trapping of the sebum, you have that inflammation. Now my question is,
Ooh.
how can ADPro manage this pathogenesis of acne formation? How can ADPro suppress the activity of the Propionibacterium acnes, the sebum trapping, and the inflammatory response?
Because acne is also the fourth of the key elements of pathogenesis is inflammation and immune response. So as we mentioned before, having a good skin microbiome could in effect help with the restoration of your skin and the prevention of acne. And if we have good bacteria that is also seen in the ADPro, like the more common ones would be the Bifidobacterium, Lactobacillus. They will help improve the skin barrier to reduce acne and the redness. And it will also, the Bifidobacterium will reduce the sensitivity of the skin. I mean, this one is more of for the eczema, but for the lactobacillus, it has been said or has been studied that it may reduce acne appearance and redness. But of course, this is also a disclaimer that Simply Nature products can be used as an adjunct therapy. If your doctors continue to prescribe you with this medication and this treatment, you can do so, but you can also try a probiotic serum, which is promising nowadays and has been studied by a lot of doctors as well for its benefits. So you could use that hand in hand. So there's no contraindication, or there's no side effects in using Simply Nature. So if you've mistakenly put a lot of the product, so it's okay. It's okay. It wouldn't be as detrimental as steroids, or if you put a lot. So that's the positive side of that, and the uh, that's the benefit of having probiotic serum. And of course, it depends. It's case to case basis, but of course it will help if you have a good skin integrity, not only for patients with acne, psoriasis, eczema, but for other patients with other skin diseases. That it is also helpful, because the skin microbiome has not only bacteria, fungi, but sometimes it has fungi, viruses. So it has this various microorganisms that goes hand I mean that maintains the integrity of our skin. So if we put that, it has a good effect on it, and it would uh hopefully, in time, our goal is to restore the integrity of our skin, right? Especially for patients who have very severe cases of eczema and psoriasis. So it's also best if we have other more natural options in the market.
I like what Dr. Grace
Yeah.
said, that it's okay to put a lot, because I can imagine our acne clients, Valentine's Day coming, so they put double strength, hoping that the acne will clear in time.
Yeah.
But that can actually have the negative side effect, because those are prescription drugs, right? Yeah.
Oh, and I have another question for you, Bino. For the conventional acne skincare that we have right now is that we have to use moisturizer, we have to use the various topicals that we need to treat the acne, and then we need to also use sunscreen. If we use ADPro, can we reduce some of those topicals that we put on our face? Because just with the conventional treatment, it's a lot. You have to put your moisturizer, you have to put your cream, you have to put your sunblock. Then you have to use a particular soap.
Wow.
So, I mean, it's a lot. Can ADPro actually reduce these stuffs that we're putting on our skin? Because too much of these stuffs can actually be more irritating, right?
Yeah. Dr. Grace, what do you think?
I think it's still best to consult your physician before doing so.
That's why there is a free consult with Dr. Grace after this.
Yes. Because acne, it's a case-to-case basis. As I've mentioned a while ago, it depends on the severity of your acne. If it's just mild, so maybe you can reduce by putting the topical alternative, like we have the ADPro. But for those patients who have severe acne, of course, the doctors would usually prescribe oral medications for that because it's very severe. Unfortunately, we have patients who deal with severe acne. But for those, I guess, for those mild cases, yes, we can. It still depends. We can put an ample amount, because usually for antibacterial or anything topical, the key is not to put so much. If it's steroid or antibacterial cream, it has the same, the skin will absorb and has the same potency regardless if you put a lot.
That is true. That is true.
Same.
One pump of ADPro will cover your T-zones very well. And to add to what Dr. Grace has said, for those who are serious psoriatic eczema patients, we've already been talking to dermatologists, and every time I talk to a dermatologist, halfway through my presentation, they say, stop, we need this. And they share with me in their protocols, especially for eczema and psoriasis patients, they have these strong protocols that use steroid creams and antibiotic creams. So the dermatologists know that the microbiome of the skin is literally destroyed or stripped bare. So they've been looking for a quick way where they can replenish this. In fact, Doc, it's the same for endocrinology, right? I mean, I think starting 3 years ago, taking probiotics is not just for children anymore. Yeah, right?
Yeah.
When we were younger, about 6 years ago, nobody takes. You only drink Yakult.
We only drink Yakult. They say it's good for you. Then that's it.
And I said today, Yakult is not good enough, because I see even GNC selling probiotics, and they are really expensive. So it's the same way. The dermatologist that I've met said the same thing. It's like when you use antibiotics for your internal. Once you're finished with the antibiotics, you go straight onto a probiotic protocol. So, like Dr. Grace has shared, when you have serious eczema, acne, and psoriasis, you use the protocols that your doctor gives you, and what will happen is that you're in between the protocols, you can apply ADPro to protect yourself, to restore the skin to a healing, natural state. So the advice is about 3 hours after you use your steroid cream, let the steroid or antibiotic cream do its job, kill all the bad bacteria like the Staphylococcus bacteria, and then after that, use ADPro to restore the skin and protect it. So that's great. You can restore your microbiome while you sleep, protects you the whole night, and that's when your skin actually heals as well. Wow, thank you. That's a very good question, Dr. Jansen. I think everybody's excited. They want their free Valentine's Day gift. So we've selected three very lucky participants today. They will be able to, and if you have a partner, if you want to go as boyfriend, girlfriend, or husband, wife to consult with Dr. Grace, she's happy to do so. So we're going to start with the online consult immediately after this. And for the rest of us who have skin issues, all right, you can make an appointment. Just follow the instructions on the screen. Sheila will help you to book some appointment time with Dr. Grace, and she'll be able to advise you and help you with your skin issues. All right. So all right. Thank you, Dr. Thank you for joining us.
Thank you, B.
Thank you, Johnson, Dr. Johnson.
All right. So here's another episode of Simply Healed by Simply Nature. So thank you again, Dr. Johnson.
Yeah, thank you for having us.
Yeah, it's been fun, and everybody have a romantic, wonderful Valentine's Day. And to all the acne patients out there, eczema, psoriasis, you're going to have a good Valentine's Day. All right, just use ADPro. It'll give you fast relief, help you subside everything. And then from there on, have an appointment with our Dr. Grace, right? And for those of you who want to check out your immune system and how PPARs can help, Dr. Johnson is definitely available for consult as well. And we will solve your psoriasis and eczema issues. All right? Thank you. Bye-bye.
Bye.